health issue, and it is not talked about enough. Welcome to our cervical health education series, and with me is Dr. Wilfred Ngwa, whom I'm going to invite to please introduce yourself before we ask the next question.
All right. Thank you, Vivian. Always wonderful to be with you. Dr. Will Ngwa. I'm a professor of global health and radiation oncology and the director of the Global Health Catalyst, with focus on, catalyzing collaborations to address disparities here in the US and also globally. And obviously, one of the big focus areas is cancer. And so I'm very happy to be here today to talk about cervical cancer.
What is cervical cancer, and what are some of the trends you have seen both globally and in sub-Saharan Africa?
Yeah, so cervical cancer in a very simple way is the cancer of the cervix. And the cervix is the organ, it's a donut organ that's really connecting between the vagina and the uterus of a woman. And so the cancer cells develop from there. Those are the cancers that we call cervical cancer. The trends are really concerning. I would say, worldwide, cervical cancer is the fourth leading cause of cancer for women. And then in Africa, it's the second leading cause of cancer and the top cause of cancer deaths. So it means that, across Africa, let me say sub-Saharan Africa, the highest killer in cancer is cervical cancer. And that's why it's really, really critical for Africa to address this. And obviously in the United States, we also have a lot of disparities that affect women in the United States, especially, African Americans and Latino populations, where we see cervical cancer more common.
What causes cervical cancer?
Yeah, there are many factors that cause cervical cancer, but number one factor, if you look at Africa, for example, is really the human papilloma virus. So basically, if you have had HIV/AIDS, then there's a very high risk that you're gonna get cervical cancer. And I really like the quote from President Bush, who was the president under which PEPFAR, the President's Emergency Program for AIDS Relief, was created, and which has saved, a lot of millions, 25 million lives and counting across the world. He said it very well when he said that, how do you, save a woman from HIV/AIDS only to have them die of cervical cancer? And that's really what we're seeing now in Africa. A lot of people are surviving from HIV/AIDS, and then now cervical cancer has become these, the biggest cancer cases that are killing a lot of women. So we really need to, heed to what he said. We don't want to save a woman's life from HIV/AIDS only to have them die of cancer. It's almost like a waste, if you do that. So that's a big risk factor, HIV/AIDS. And then the second one is really just there's a lot of movement towards people, if you just live unhealthy lifestyles, the foods that you eat, so your sexual behavior, because that obviously can also expose you to HIV/AIDS. And then, being exposed to, a lot of chemicals like, in the environment, toxins, for women who do a lot of agriculture, pesticides are great causes of that. And then a big factor, which is really, what's causing Africa's cancer explosion, is that people are living longer. It used to be that people would die of malaria, tuberculosis, HIV/AIDS, and other things earlier. But now, because you are living longer, so cervical cancer and other cancers are really one of the big risk factors is just being older. As we get older, our cells can no longer repair the DNA damage as effectively as they can when you are younger, and so those are some of the factors.